when we use integrative medicine, right, it's simple recommendations, simple strategies that are affordable.
Yeah.
And they don't require our patients a tremendous investment of time, effort, or money, right? So this is like the easiest strategies that your patient can just utilize right away.
Its therapeutic actions come from the essential oil, rich in menthol, menthone, and then 1,8-cineol. Just a note, when it comes to peppermint and digestive issues, the main action we're going to talk about is the smooth muscle antispasmodic action. And you can't get the same action from drinking peppermint tea, by the way. So it needs to be like a oil, enteric coated capsule, so gut-friendly, if you will, capsule of peppermint oil. Okay, so menthol is going to act as a smooth muscle antispasmodic. So it calms down spasming muscles in the gut. It blocks calcium channels. And so it's a key mechanism for IBS symptom relief or patients with kind of just functional abdominal pain. You think about peppermint as a good resource for them. Another fun historical fact for you guys. Peppermint became so popular in the 1700s that it was listed in the London Pharmacopoeia as an official colic remedy. How does it work? Let's take a look at a picture from a study published in the Frontiers in Pharmacology in 2020. Here are 3 key ways that peppermint oil appears to reduce pain by several mechanisms, actually. So it's relaxing the smooth muscles of the gut, like we mentioned, mainly blocking those calcium channels that normally trigger muscle contractions. And then when the gut isn't tightening or spasming, the pain signals coming from the digestive tract dramatically reduce. Peppermint also reduces the sensitivity of gut sensory nerves, especially through the cooling sensation receptors like your transient receptor potential melastinin 8, which is a very really long name, but just know that it's going to help reduce how sensitive the gut nerves are. So when these nerves are less reactive, patients feel less cramping, pressure, and discomfort. And then honestly, with a lot of GI patients, they just have so much discomfort and pain for so long that their gut nerves are hypersensitive. And you can take someone who doesn't have GI issues and kind of stimulate them with the trigger. And the patient who has a history of just GI pain disorders, they have a higher reaction to like a stimulant than somebody that does not have chronic GI pain. So their nerves are just kind of hyper reactive. So peppermint helps to kind of calm that down. And then finally, peppermint shows anti-inflammatory effects in the gut, helping to calm immune-driven irritation that can also amplify pain and digestive symptoms. So many ways by which peppermint is a great tool. I would say just clinical pearl from my experience, if your patient has like esophagitis, so an inflamed esophagus, if they have eosinophilic esophagitis, I would be cautious about using peppermint oil because it does relax the lower esophageal sphincter. So if they have already like an irritated or inflamed esophagus or Barrett's esophagus, precancerous esophageal cells, that can actually cause more acid to just kind of pop up into the esophagus and irritate the lining. So that's the only like patient cohort I would just be cautious of using it in, that like the acid reflux patient population in the esophagitis. So an IBS clinical trial, let's like talk through this clinical trial. So a landmark double-blind placebo-controlled trial published in the Journal of Gastroenterology evaluated enteric-coated peppermint oil for IBS. This was 110 IBS patients. They took one enteric-coated capsule 3 to 4 times a day before meals for 4 weeks. The result, 79% reported pain relief versus 43% with placebo. And there were significant improvements in bloating, distension, and flatulence, so less gas. Minimal side effects. Mostly heartburn if the capsules were chewed. And so little pearl for you, another little pearl. For IBS, enteric-coated peppermint oil, one capsule 3 to 4 times a day significantly reduces abdominal pain and bloating in as little as 4 weeks. And so, IBS, you have to have abdominal pain to categorically be diagnosed with it. So it's a significant, peppermint oil helps with a significant component of that disease or disorder state. So just something to kind of keep in your back pocket.
Right. And that's why the integrative medicine approach in my practice, at least, is something that we used for all patients. Right. Even patients that maybe they were not ready for us to go much deeper into the functional approach and dive into the root causes and do a lot of work there, or maybe order functional labs. But the integrative approach is something that we utilized for everybody, right? And that's exactly why in the advanced functional and nutritional medicine program, we got the functional medicine and we also got the integrative together. And this is, again, why I'm so excited about your class that is starting next month, which is the Integrative Health Practitioner, because these are tools that practitioners can use right away.
Right away. Yeah, I agree.
Yeah. Even if they only have like 10 minutes per visit, it literally takes like 20 seconds just to make the appropriate recommendation. And they'll get an app. They don't have to remember everything, the different mechanisms, how it works, how to personalize everything. We'll go a lot deeper into the nutrition and lifestyle medicine, but you also have an app and a clinical guide. So everything is there. You can pull it real quick. So that's going to be really cool.